So painful periods, or medically also known as dysmenorrhea, is one of the most common concerns that women face today. If you actually look at the statistics, almost 8 in every 10 women struggle with painful periods. That is quite a lot of us, right? Having a slight bit of discomfort during your period cycle is very normal. But if you are someone who has extremely painful periods that prevents you from even carrying out your day-to-day activities, then it is very important for you to figure out the cause and accordingly learn to manage your period pain better. So in this video, we are going to discuss about the conditions that can make your periods extremely painful and what is it that you can do at home to manage your period pain. So if this is something that interests you, definitely watch the video till the end. Hi everyone, I am Dr. Zainab Tajir. I am a homeopathy consultant and psychological counselor. I help women balance their hormones and help couples conceive naturally through homeopathy and holistic lifestyle changes. I create content around hormonal balance and fertility. So if this is something that you are interested in, definitely consider subscribing to my channel. As already mentioned, whenever you struggle with period pain, it becomes very important for you to understand the cause. We primarily divide painful periods or dysmenorrhea into two categories. The first is primary dysmenorrhea. So the kind of period pain that you've had right from your start of the period, that is right from menarche, and it does not have any underlying pathology. Now in that case, it's usually because of some minor hormonal issues which causes your periods to be painful. The second type is secondary dysmenorrhea, which is usually something that develops later on in life and has an underlying pathology. So conditions like adenomyosis, endometriosis, fibroids, cervical stenosis, etc. all can make your periods extremely painful, and running an ultrasound can help you understand if you have any of these pathological conditions. Now, when it comes to dealing with secondary dysmenorrhea, it is very important for you to treat the underlying pathological condition. I will be creating videos around each one of these. So if you haven't subscribed to my channel yet, please go ahead and do it. In this video, we are mainly going to discuss about primary dysmenorrhea and how you can help balance your hormones better to help manage your period pain. So let's get into it. The first and the most common thing that all of us tend to do is using a hot water bag. So using a hot water bag on your abdomen or on your back, especially when you are suffering from painful periods, can help with relaxation of muscles and ease your period pain. The second thing that you can do is massage your abdomen with essential oils like eucalyptus, lavender, chamomile, etc. Each of these has anti-inflammatory and anti-spasmodic properties that can help relax your abdominal and pelvic muscles and therefore ease your period pain. The third thing that you can do is include herbal teas into your routine around that time. So herbal teas like ginger, chamomile, peppermint, fennel seed tea, etc. All of these have again anti-inflammatory and analgesics, that is pain relieving properties that can help manage your period pain. But not only this, they also have a very calming and soothing effect that can make managing your period pain slightly better. The fourth thing that you can do is including important yoga asanas into your routine. Now we do know that there are so many yoga poses that can help open up your pelvis and improve the blood flow to your pelvis muscles and thus relieve period pain. So yoga asanas like child's pose, supported bridge pose, supported forward bend pose, legs up the wall pose, cat cow pose, etc. All of these can help relieve in your period pain. The next and the very important thing to do is to take care of the diet. Now we do know that having a diet which is rich in magnesium and omega-3 has known to help with relieving the period pain because of its rich antioxidant properties. So you can include foods like almonds, spinach, black beans, dark chocolates, lentils, etc. and also fatty fish, etc. into your routine, especially before and during your menstrual cycle, in order to make sure that your periods are less painful. The next important thing to do would be including the necessary supplementation. So supplements like vitamin E, omega-3, vitamin B12, vitamin B6, magnesium, etc. Each of these ones have shown to help with relieving period pain in women that have extremely painful periods. So you can also consider these supplementations. but I would definitely advise you to speak to your own practitioner before you resort to any forms of supplements. And the last thing to do would be to include adequate physical activity into your routine. Now, this is not only something that you do while you are on your period, but something that you do throughout the month. So physical activity, like we know, is known to help with balancing the hormones, and the better the hormonal balance, the better your periods are going to be. Now, managing period pain is not like a one-time thing, but it's about an entire lifestyle management. So if you eat right, make the necessary lifestyle changes, exercise regularly, and also manage your stress, you can definitely make your periods less painful. Now, if you have any more questions related to this, please feel free to leave them in the comment section below. And also, don't forget to subscribe to my channel. I will see you again next week.